First up here is a mole that they're lasering on the upper lip of an individual. Now, I do not recommend to laser moles to get them away, because you're not testing them to make sure that they're not cancerous. And just because a mole has been there a long time does not mean that it can't turn bad. It's also not a guarantee to have a scarless procedure. So, I would prefer to remove it and have it tested. But we don't see the final result on this to see if there's a scar. This looks like a CO2 laser, which is a resurfacing laser of the skin. And if you look close, you can see the skin tighten around the little holes where they are firing the laser. It targets water in the skin and is one of the best treatments to improve the appearance of the skin and take years off of your appearance. Here they are lasering off a mole on this gentleman's temple. This is something I would numb up and shave it off, and then if it needs anything to improve the scar in the future, I would laser it after we have a pathological diagnosis to make sure this is not cancerous. But simply lasering a mole or a birthmark to make it go away is not my favorite thing to recommend because there are risks. Always fun to watch laser tattoo removal, which targets the ink in the skin. That's probably a vacuum to remove any smoke plume, or it's blowing cold air on the person to keep them comfortable. You're going to have to go through several treatments in order to get that tattoo to completely fade away. This one really makes no sense to me. You'd have to numb this patient up, and taking a laser to remove it does not decrease the risk of a scar. A blade would do this much quicker. It seems unnecessary to me. In my opinion, this patient's a candidate for Accutane. They've got a lot of acne. They're at risk of scarring. But we're going to be doing some extractions here, and it's going to be really satisfying. But they really need a treatment plan to go ahead and prevent future scarring from really bad acne. They're using an 11 blade to open these up and help them to come out a lot easier. The Sac Depth Spa. We've seen a lot of their videos on the channel before and they do a good job. I like their technique. I'm just very curious what else the patient is getting to take home. What are they treating their acne with? Because without proper treatment, a lot of this will come back. And if the patient is starting to scar, we have tools to prevent that. And Accutane can be a great option in those circumstances. A lot of blackheads. Don't know if this is in a nose. It almost looks like it's in a nose. Maybe in an ear. We're just so zoomed in it's hard to tell. I think it's an ear. Using a comedone extractor. They're opening things up nice and popping that out. Good advice there. Clean the area before and after you're doing extractions. It's probably been there a while. They're opening it up with an 11 blade and mashing on it. It's not super dark, so I don't think we're looking at years of this blackhead. Getting quite a bit out of there, though. Very well. This is an older gentleman who's probably been in the sun a good portion of their life, working outdoors, and they've got a lot of skin damage from ultraviolet radiation, also potentially from chemical exposures. You can get something called chloracne, but a combination of not great skin care, lots of time outside. They've developed really damaged collagen in the skin, and likely a condition called Favreau syndrome where you get lots of big dark blackheads, particularly on the nose and around the eyes. This condition is difficult to treat without resurfacing the skin with the laser, but the extractions are super easy and very satisfying to do. I send a lot of these to my esthetician, but every once in a while I'll get in there and pop some out myself. Guys, thank you so much for joining me on this video. I hope you've enjoyed it as much as I have. And if you want to support the work I do in the mobile clinic, go ahead and search for any skincare you want down in the video description. That helps to bring in revenue where I can go treat people for free in my mobile clinic. So thank you for joining us. Share this video with a friend who loves pimple pops as much as you do, and I'll see you on the next video.